A drug is a chemical or biological substance that affects the body and its functions. Drug absorption is when a drug enters the bloodstream. The level of absorption can affect the speed and the quantity of the drug at the site of action. This is termed bioavailability. If a tablet releases the drug quickly, blood levels may become too high, whereas slow release may result in low levels of absorption. Additional factors affecting absorption and bioavailability include the properties of the drug and the physiology of the person, such as pH levels in the stomach and its speed of emptying. Therefore, specific formulations are used to release the drug at the desired speed. Common formulations include tablets, capsules, suppositories, transdermal patches, and solutions. Drug metabolism is the process by which the body breaks down drugs, which mainly occurs by means of enzymes located in the liver. Many factors, including intake of specific foods and other drugs, can increase or decrease the speed at which drugs are broken down, and thus determine their levels within the blood. A drug may be broken down to stop it from working. However, there are other drugs that need to be broken down or modified before they become active. These are known as prodrugs. Some drugs are directly eliminated from the body by the kidneys in urine. For this to happen, the drug must be water-soluble. Drugs that are not water-soluble may be metabolized by the liver or enzymes in the blood into breakdown products that can be eliminated in urine. Diseases that affect the liver or the kidneys can cause blood levels of a drug to increase.